My name is Cindy Rifenburg, and I'm an occupational therapist. I work at Lehigh Carbon Community College. It's an occupational therapy assistant program, and I've been the fieldwork educator there for 24 years. I'm putting together a couple short little videos that will help future fieldwork educators have a better understanding of how to work with students who are coming to their facilities for either level 1 or level 2 fieldwork experiences. So today we're going to talk a little bit about how to give students, occupational therapy students and occupational therapy assistant students, feedback and how to use some information towards scoring them on their midterm and their final evaluations. So first, let's talk a little bit about feedback rules. There are a few rules that are really helpful when you give feedback to occupational therapy students. First of all, it needs to be frequently. And when I mean frequently, it means on a regular basis, either daily if you're with the student all day, or at least weekly, and it needs to be formal if it's weekly. So formal means you need to put it in writing and you need to have a day set aside where you are actually going to do that. Perhaps you're always going to do your formal meeting on a Thursday or a Friday or a Monday of the following week, but you need to have a designated time in which you're going to do that, and then the feedback needs to be in writing. Please try to do your feedback in private. That's really important for a student. No student likes to have someone talking about their performance in front of other staff members or even out in a cafeteria if there are other employees in there eating lunch and they're working with the student and also overhearing the conversation. And then only provide as much feedback at the time as the student can absorb. Sometimes a student is able to hear a lot of feedback and help them make some changes, but other times too much feedback is overwhelming and they won't be able to remember the important key pieces you're trying to help them understand. Also, be aware of your own tone of voice and your own body language. There are times when any fieldwork educator is frustrated and maybe not anything to do with the student, but your own frustration about something going on in your life or on the job can come across to a student during the fieldwork experience and is evident in your own tone of voice and can make a student feel quite uncomfortable. Then, when you do need to use your tone of voice or you do need to be firm, there are times that's appropriate. Perhaps when you're working with a student and there's a very serious situation regarding safety, yes, you need to intervene right away, and you do need to use a firm tone of voice. Safety is very important. But then there are other times when that may not be so critical. For example, if you're discussing how a group went with a number of clients that the student has been treating, that may not be a safety situation. It may be more of a clinical discussion, and so be aware again of your own body language and your own tone of voice. Sometimes using humor is a nice, effective way to work with students, or even sharing some of your own stories. But again, get to know your student, as we talked about in a previous video. Learn about your student's learning style and whether humor is an appropriate means to work with that student. Now, feedback can be verbal, can be in the moment, or it can be later. When you are giving feedback, especially verbal feedback, make sure that you're using I statements. If you use I statements, that tends to help de-escalate a situation in which a student may become defensive. The student is not becoming defensive just because you're giving them feedback. It can be uncomfortable. It's uncomfortable for anyone to have their performance critiqued constantly. They're always under the microscope, and you need to remember what that feels like. So if you use I statements versus you didn't do this or you need to do that, and you say, I observed you perform this, that is taken usually much better by the student. Also focus on exact situations with clients. Try to provide examples of the real situation that you saw the student working with the client so that they can use that as their learning tool. Show your clinical reasoning. When you work with a student, you have been an experienced practitioner. You clinical reason all the time and you don't even realize it. But talk about your clinical reasoning out loud. Let the student hear how you problem solve and work through particular clinical situations. That type of clinical reasoning and talking about it out loud allows the student to understand the decision-making process that a clinician will go through and helps that student refine their own skills. That's another really good way to give feedback. You can talk about a situation in which you'd like to see something change and then describe it through your own clinical reasoning. Also, in your meetings, let the student know what you'd expect to see next time regarding their performance. That type of clear feedback is really helpful. Now let's look a little bit at written feedback. Written feedback is just that. You do need to put it in writing, and it does need to be written down every week. That's really a protection for both you and the student. I've seen both times in which a supervisor provided very clear documentation so that the student could understand why they were not successful on their fieldwork. I've also seen it in the reverse, in which they did not provide clear expectations all along, so the student really was unsure about where they stood regarding their progress. Again, make sure that that meeting that you have with the student is formal. Set aside some time once each week to sit down and go over the written feedback. Not only provide the written feedback in describing the student's performance, and again, use client examples if that's the most helpful, but also identify the student's strengths and what you see as new emerging skills that they're showing over the past week. Students always like to know what things that they're starting to make progress with. Pinpoint any areas that you still would like to see further improvement with so that the student knows what they need to work towards. Identify what that focus should be for the next week. You can clearly state for the next week you'd like to see the student focus on, and this way they know what they're going to try to practice and hone in on during that next week. At times it can be overwhelming for a student to think about all the areas they need to show proficiency in. If you narrow it down each week, that gives them the stepping stones that they need. Another couple important pieces, try to identify what you will do to help support that student's learning process. For example, can you demonstrate the assessment tool again, or can you model once more how you're going to interface with a challenging client and their family? Students often learn that effectively if they're watching your behavior and how you model your expectations. Supervision is a collaborative process. So a supervisor also needs to be able to ask for feedback from the student. Is there something that you need to change to better meet the student's needs? It's okay to ask. You're learning at the same time that the student is learning, and asking for feedback is really helpful for you too. Now let's reflect on the typical student progression. Remember that we're not looking at expert level by the time a student has completed their occupational therapy assistant internship. We're looking for competence, entry-level competence. So when a student first starts out on fieldwork, they're typically a very new beginner. They may not be aware of what some of their strengths are. They may know that they've learned some of this in school, but really don't see yet how they're applying it. Or they're applying it in a very rigid manner. They're not able to see the variables, and they're not able to grade or modify an activity for a client's needs. They're kind of rigid in some of their performance, and they need a fair amount of guidance. They also need time to treatment plan, and for some students that's literally writing it down. They need that kind of time. They're not going to be able to do that in their head, and they're not going to be able to do it quickly. They can't wing it, as we might say. Not in the beginning. By the time they get to midterm, we might call them more of an advanced beginner. They're starting to carry about half of the caseload. They're much more comfortable with the clients that they see on a regular basis, but when they have new clients or a medically complex client, they're still going to need a great deal of guidance. They have ability to plan treatment sessions. They're still doing some of that perhaps in writing or planning ahead. They're not going to be able to pull that all off just in their own head, but they're starting to be able to grade the treatments to meet the client's needs a little bit more effectively. And they're starting to notice again some of the variables that might impact the therapy session. By the time they get to the final, when you're in your final week of their internship, you're really looking at a student who should be showing you competence. Now that doesn't mean that they have to be competent in every single area. There may be still one area in which you feel like they need to have further progression, but the vast majority of their skills, you really need to see competence. What does competence look like? The student typically is able to go step by step, but they can be flexible. They can do some of that treatment planning in their head. They don't need extensive periods of time to do treatment planning. They're starting to understand the variables that might impact the client's performance and the treatment, and they're taking those into account and taking the initiative to follow through on those things. They're explaining the treatments effectively, and they're also providing safe and appropriate treatments for their clients. Now, how does that all come together when we score the student? Well, When you score an occupational therapy assistant student, or an occupational therapist for that matter, you're going to want to use the American Occupational Therapy Student Evaluation Forms. Those are always being modified and updated, and I know there's some presently now being worked on. You want to try to make sure you're using the newest AOTA evaluation form. Along with that form, you should make sure that your behavioral objectives are matched to the AOTA evaluation form. If you're using an evaluation tool for a level 1 student, most of your facilities will provide that level 1 evaluation tool for you. For the midterm, remember, you're basing your evaluation on the student's performance as they progress toward entry-level competence. They're not to show you or demonstrate entry-level competence at this point, although you will see some of those skills in some areas, but it's a progression. Are they moving in that correct direction all along the fieldwork? As you move into the final evaluation, again, that is when the student should be able to show you that entry-level competence in the vast majority of their skills as noted on the AOTA evaluation form. When you do score the form, it's really helpful to have the student complete the evaluation on themselves. This gives them a chance for self-reflection and helps with their own growth. They can critique their own performance and help identify areas that they feel they need to make improvement on. Please do add written comments. Many times fieldwork educators are only listing things like the number score. And as you know, the number score doesn't mean a lot. When you look back on the evaluation tool later, it's the written comments that really provide you the most guidance and allow you to make your progress. So please do include written comments. From the student's perspective, they're often much more focused on the score. Am I passing? Am I passing? And for you, you have to guide them through that. Your feedback to help them along the professional path is much more important. And I know that students often miss that. Ask yourself, as the fieldwork educator, are you seeing progress every week in that student? Some weeks there may be big pieces of progress, other weeks a little smaller pieces of progress. But every week you should be able to see that the student has made some progress towards that entry-level competence. Once the evaluation has been completed, you need to clearly identify and discuss with the student if they are passing or not. It can't be something that's vague or that they're unsure of. Obviously, the grade or the score on the evaluation tool will help them, but you also need to clearly identify that for the student. I always tell my occupational therapy assistant students to ask the question, am I where I should be? And if the supervisor is able to say, yes, I feel like you are where you should be for this point in the fieldwork, whether it's 2 weeks in, 6 weeks in, or at the end. That's a really important question to know because, again, you're looking for small steps of progress each week. If there is a concern about the student's progress and it is reflected on the evaluation tool, it's really important that you contact the academic institution as soon as you are aware that the student is not progressing as you expected. When you work alongside the academic institution, they'll help you come up with some options for helping the student. They will usually meet with the student, either in person or by phone, and the same with you as a fieldwork educator, and give you some tips and suggestions on how to help the student move along. Sometimes it's a little bit of a change in approach. Sometimes it's talking to the student, letting them know that they need to step up the pace or it's okay to be more assertive. But it's really important. If the student really needs to have a learning contract, that's something else that the academic institution can assist you with. Putting that into place and really guiding very detailed criteria in terms of what is expected for that student in order to successfully pass their fieldwork. All of those things can be very valuable. There's also a number of resources that you can utilize to help you in your fieldwork experiences as a supervisor or fieldwork educator. AOTA has many resources online under the Fieldwork link, and you can also talk to a number of academic institutions who will provide you materials that will help you become a more effective fieldwork educator. AOTA also offers a Fieldwork Educator's course, so there's lots of options to help you along the journey. And really, providing fieldwork supervision for students is a professional obligation as well as an enjoying process we can all learn by taking on interns. and I hope these videos have been helpful to you.